And welcome to Prisma Health's Business Health Solutions COVID and Wellness Weekly Update. I'm Dr. Rachel Brown. I'm the Medical Director of Prevention and Wellness with Business Health Solutions. And we are doing these weekly webinars to help you feel informed about the COVID pandemic so you can make the right choices for your workforce's health and safety. So right off the bat, I want to say that it is March 26th. So please take that into account when you're listening to this video and make sure all the information is up to date. I also want to say that we're in a good place. We've been at a 4.5% positive rate of cases in South Carolina for a few weeks now. So we have definitely plateaued at that low rate. We'd love to see it go even lower. So please continue to do precautions. We'll talk a little bit about why that's still very important. We did hear that nationally the cases may have gone up slightly, about 5%, and there is some concern that that may be related to the development and introduction of variants. So let's go back to talking about why it's so important to maintain precautions, and also in the context of what our vaccination efforts can do for us as that number of vaccinated folks grows. So I want you to imagine a large auditorium, and we put 100 folks in that auditorium, and this is pre-vaccination. We introduce COVID-19 into that group, and it's going to spread. Of course, right? Like wildfire. We're going to have an outbreak, and folks are going to suffer the consequences of that infection. If we put masks on those folks and we make sure they're socially distant, now we've dropped the rate and the risk of people getting infections. All right, now let's fast forward to that same room, 100 folks. Maybe 30 or 40 of them are now vaccinated, are now fully vaccinated. It's actually going to be a lot harder for an outbreak to occur, for spread to occur, if we have a proportion of the population that can't be infected by the COVID-19 virus and potentially cannot spread it. If we add masks into the equation, then again, we get a very high rate of protecting everyone and a low risk for outbreaks and mass spreading of that COVID-19 virus. Of course, it's going to spread, but not as quickly and not to as many people. Now let's fast forward even more and take that same 100 people and let's vaccinate about 3/4 of them, okay? If we introduce COVID-19 at this point, that's going to be very difficult for the virus to cause an outbreak. There are just too many people who are resistant to infection and again potentially can't pass that infection along for any large amount of infectivity to occur. So you can see that we're not at that point yet, and that's why we have to consider this a race between getting enough people vaccinated and keeping that virus from spreading. And now the other thing I want you to keep in mind, and I've mentioned before in my videos, is spread is one way and one mechanism by which variants occur, okay, and come into being. So again, we want to keep that spread as low as possible because we don't want any more variants and we don't want any more infections. And right now that means, while we're still in the early phases of our vaccination process, that we continue to wear masks, we continue to socially distance, and we continue to avoid large crowds. We will get baby step recommendations as these numbers of vaccinated folks grow from our organizations like the CDC and others about what kinds of precautions we can begin to relax. But we need to be patient and dig deep and continue to do what we've been doing over the last year so that we can win this race and we can get past this infectivity and the variants and this pandemic. So let's talk about those vaccines for a second. As almost all of you know, we've got 3 approved vaccines in the United States right now. Pfizer and Moderna are 2-dose mRNA vaccines. We also have the Janssen & Janssen or Johnson vaccine, which is a 1-dose viral vector vaccine. Now, let me make 2 things perfectly clear because I get these questions a lot. Number one, these vaccines cannot give you COVID-19. They do not cause COVID-19 infections, okay? So there is a small part of the genetic code for a protein on the COVID-19 virus that is delivered to your body in these vaccines. your body will build the protein that code is the blueprint for, and then will mount an immune response against that foreign body. But the small protein that's built cannot infect you. You do not get COVID-19 from this vaccine. All it does is stimulate that immune system to build the building blocks so that if and when you are exposed to the real COVID-19 vaccine, your body already recognizes it for what it is and sends out those building blocks to get rid of it. Okay. That's how that works. Some of you asked me about the viral vector that this genetic code is delivered via through with the Johnson & Johnson vaccine. That virus is also incapable of infecting you. It has been incapacitated you. But what it does do is stimulate your immune system a little more because it is another virus, another foreign body. And so it actually boosts the immune response. So all of these vaccines are very effective. They do not give you COVID-19, and they also do not in any way alter your own genetic material. So while you are being exposed to the genetic material of the COVID virus so that you can build a tiny piece of it that can't infect you but can boost your immune response, it does not integrate with your own genetic material at all. It can't. So I also want folks to understand that that is not occurring with these vaccines either. And let's talk briefly about the Astrazeneca vaccine, because some of you may have heard that it's had a bit of a roller coaster course through its EUA authorization process. And here's what I'd like to say about that. We know that they want to go back and look at the data with AstraZeneca and be a little more rigorous around studying this. We should be thrilled. We should be thrilled because this means that our system, this proves to us that our FDA approval system and the EUA approval system is working. It is catching what we may not feel comfortable with and what we need to go back and take another look at. It doesn't mean that in the end, the data will show that AstraZeneca is a good or not great vaccine. It doesn't impact that. It's just, it shows us that the process works. It stopped the progress and it said, wait a minute, let's go back and look. And that's what we want to happen so that we know things are being checked and double checked. So that's all I'm going to say about AstraZeneca. Let me share with you my screen. We're going to look at some websites that we've seen numerous times before, but for folks who may be joining these calls for the first time, I do want to show these to you. The first is our Prisma Health COVID-19 vaccine page. If you scroll on down, you certainly can look at who is eligible. Again, this is the 1A and 1B groups right now. And you can also click on this button to schedule or to register for MyChart, which is our system here at Prisma Health, either right here or to call and get help with that registration. And once you're registered in MyChart, this is where you're going to schedule your vaccine. Now, let me pause here because I know some of you may be shaking your head saying, yeah, we would love to schedule our vaccine appointment. And we fully understand that it's frustrating, that appointments are going very, very quickly and that it's difficult to find an appointment to get this vaccine. The supply is much lower than the demand still in South Carolina. That mismatch is closing gradually, but it is still it is still quite wide. We are helping in the best way we can. We're trying to open up appointments for the week on Tuesdays and Fridays so that you only have to go on Tuesdays and Fridays to look and see what appointments are coming up instead of checking the page every single day of the week. Hopefully that will at least take some of the burden off of you. And of course, we are using every single dose of vaccine we have and making sure that there are appointments so that everyone can get every dose of that vaccine can be used. Now, if you're finding that through our system you are not able to get an appointment, there is a second way, and that is by going to the DHEC website and clicking on Find a Test Location. Now, I have already done that. So I'm going to do that for you. Once you click on that, you'll see this button here. And when you click on this button, it's going to take you to a map. Now I've kind of zoomed in. I'm sorry, we're looking at the testing one. Let's look at the vaccine. All right, I have to wait for, there we go. Okay, so again, you can click on find a vaccine site close to me right here. And then once you do that, it's going to take you to a place where you can put in a zip code. I've put in a Richland zip code this week, and it will show you where all of the available vaccine sites are. You're going to see our sites, but you're also going to see pharmacies. You're going to see DHEC. You're going to see other healthcare systems offering. You can click on these folks and try to find an appointment as well. Okay, so that's your options right now, is using Palmetto Health or the Vax Locator. Remember that to make it easy for you, Prisma Health. Prisma Health is listing their appointments for the entire week once we get our supply, and those will come out on Tuesdays and Fridays. Now, when you are talking with your employees about the vaccine, we hear from you all that you are getting different kinds of sentiment around whether folks are willing to get the vaccine or not. One thing that I want us to start understanding is, while there is a level of vaccine hesitancy out there and folks who aren't sure they want to get the vaccine, I do not want us to confuse that with lack of access to the vaccine. So Prisma Health is working very, very hard to reach out to communities that may be in high social vulnerability index areas, meaning they have lots of demographic factors that make access to the vaccine difficult. Because we don't need to fool ourselves and say, well, this might be a population that doesn't necessarily want to get the vaccine. It may be a population that absolutely does and yet can't get to it. So a lot of our efforts with Prisma Health have been collaborating, or excuse me, and in Business Health Solutions have been collaborating with our mobile unit to reach out to some of those areas that have that high social vulnerability index. We want to make sure that folks who can't come to our community sites, such as shift workers, areas and folks in rural areas, folks who may not have Wi-Fi or transportation, we want to be able to deliver this vaccine to them as well. So let's talk about the vaccine. I want us to pull up, if I can get to it, here we go, the Vaccination Dashboard. It'll take a moment to load because I love looking at this. Look at this, 15% already of our residents have gotten their have been fully vaccinated, meaning 2 doses of Pfizer or Moderna or 1 dose of Janssen, and that's up 4% just from last week. If we stay on track with that, by summer, we'll have the majority of our population vaccinated. The other thing that I want to talk to you about in terms of vaccinating folks is what you can do now that you're vaccinated. Okay, so as I mentioned before, we're going to see kind of baby step recommendations as more and more folks get vaccinated. So right now, if you are hanging out with other folks who've been vaccinated and you're in a private area, you're not exposing yourself to others who may not have been vaccinated, we can hang out without masks, which is wonderful. Okay, this is a treat for anyone who's been vaccinated. The other thing is, if you have been vaccinated and you want to visit a household, just with that household members only, as long as they're low risk, you can visit with them if they've been unvaccinated. And I like to think of this as the grandparent rule. So this is if grandma and grandpa have been vaccinated and they want to come visit their grandchildren who may not have been vaccinated, but of course are who are at lower risk, they can do that and feel safe about that. Of course, we're always watching for symptoms. But the other one that's important to you all as businesses especially is that folks who have been exposed to someone with COVID, with a known COVID infection, do not have to quarantine anymore. If they've been vaccinated, they can simply watch for symptoms. So this is going to be huge for modifying your PTO policies. Okay. Like I said, what we can't say for folks who have been vaccinated is that you no longer have to wear your mask in public or you don't have to social distance. That is not the case. Okay. So even if you've been vaccinated right now, until we get to those higher numbers we're looking for, you still need to wear your mask to protect yourself and others. Also, with the variants, infections going up, you still need to stay 6 feet apart, and you still need to avoid crowds and gatherings. You also need to consider, even if you're vaccinated, travel guidelines. And remember, this is usually a hard and fast set of guidelines for international travel, but it's recommended as well for domestic if you're able to do it. And that is to get tested within 3 days of your trip. Of course, if it's negative, then proceed, and then be tested when you come back somewhere around day 5, and really trying to limit your exposure after you return from your trip to others for about 7 days, assuming that 5-day test comes back negative. We're not doing a lot of that for domestic travel. We may see those recommendations, become a little bit more hard and fast. We're certainly recommending that for international travel, but even if you're vaccinated, those recommendations still need to be followed. All right, so last but not least, I want to talk about testing since we brought it up in the context of travel. Prisma Health is no longer offering drive-through testing services. We are moving our testing to our ambulatory care sites and primary care offices. So please and encourage your workforces to use their primary care office if they're experiencing symptoms, to reach out to them and find out whether they need to be evaluated and have a test. The primary care office will order that test, and they can come in and have that done. Now, for clients and other employers and employees who are utilizing the call center, the Prisma Health call center, the same thing will happen. The nurse triage folks will determine whether or not someone who's maybe had an exposure or is experiencing symptoms needs a COVID test. They will place that order, but they will recommend that the person calling in have that test done at their PCP's office. Now, they will not be charged for an additional PCP visit, nor will they be charged a copay, nor will a healthcare claim be dropped. Okay, they're just going to that site to get that test ordered. Now, and this is the same process if they do an e-visit and use our virtual visit exam services as well. Now, if the person who's calling or using our e-visit does not have a primary care provider, we will be recommending the DHEC testing locations. So what you do here is you visit the website, COVID-19 testing locations. You'll click on this button. That will take you to this page that I erroneously visited earlier in the video, and I've kind of zoomed in on Greenville here, and it will show you all of the DHEC testing sites. You can search by city or county. You can look for events. You can look for free testing. Almost all of the DHEC sites are free testing. And then you can find out what their hours are and whether you need to schedule an appointment or not. Okay, so if you do not have a PCP, which is where we will be doing our testing starting in the upstate on Monday, and the 29th, March 29th, and on the following Monday in the Midlands, April 4th, is that? April 5th. You want to use the DHEC site if you don't have a primary care physician. And then finally, as always, I encourage you to go to our Business Health Solutions page, Creating a Safer and Healthier Workplace. Scroll on down. You can share the video links from here with your employees. This information is so important for them, and it may be difficult for you to get it out every single time. Or you can call us. If you have questions, we can email, we can schedule a call, we can schedule a consult. We can help you with registration or registration events or registration trainings. We can provide education around vaccines, and what they are, how they work, and make sure folks have the right information around behaviors and precautions. We can talk about stress management over this last year. Whatever kinds of education you need, please reach out using this number. So that's what I have for this for you this week. Not a whole lot of new developments, but just asking everyone to remain patient. We're going to vaccinate everyone we can. It may just take a little longer than we had hoped. And as always, please know that we are caring for you so that you can care for your workforce.